Hi, I'm Dr. Anna Garrett, Chief Mojo Officer at www.drannagaret.com, and I help women who are struggling with symptoms of perimenopause and menopause get their hormones back in balance without using hormones so they can rock their mojo through midlife and beyond. And one of the topics that comes up frequently in my Hormone Harmony Club group on Facebook, which you can join, all you have to do is request to join and I'll add you, is what's going on with my body? I'm having periods every 2 weeks, I'm having them every 6 weeks, and I've always been a 28-day kind of girl. Help! So here's what's going on. You're in perimenopause, and this is perfectly normal. Up until about the age of 40, 90% of women have regular periods, but between the ages of 40 and 50, only about 10% of women have regular periods. So that means there's 90% of us that are doing something that's outside of our norm. And the reason for this is because we have low progesterone. And the reason we have low progesterone is because we don't ovulate every month. And progesterone is produced in the second half of your cycle. So when you ovulate at day 14-ish, your body begins to produce higher levels of progesterone in case you get pregnant. And when you get to the end of your cycle, if you're not pregnant, progesterone drops very quickly. And that's what signals your body to have a period. Without that, estrogen just continues to stimulate the lining of your uterus, and eventually it'll drop low enough and you will have a period, but it's very irregular, very unpredictable, and very annoying in some cases. I myself am on the every 2 week plan right now, and it's not a whole lot of fun. So I understand exactly where you are. So what to do about this? Well, one option is to do nothing because there's really nothing wrong. But if you'd like to try to normalize things a little bit more, you can clean up your lifestyle, and that means avoiding alcohol because alcohol produces more estrogen and you don't need that. It means eating meats that are not raised with hormones because, again, those hormones act like estrogen in your body, and that's what we're trying to avoid. If you'd like a more herbal kind of approach, then Vitex or Chase Tree can help get your estrogen and progesterone levels back in balance, which may help the regularity of your periods. You can also supplement with bioidentical progesterone, but I don't recommend doing that without the help of a trained provider such as myself. So when to call your doctor? If you are just having irregular periods and you're not having pain and you're not having bleeding or other things that feel out of the ordinary to you, I would say you're probably safe just riding it out because eventually it will all calm down. If your body's intuition is telling you that something is wrong or you're just uncomfortable with the situation, then by all means, put your mind at ease and go see your doctor. I'd like to invite you to go visit my website, which is www.drannagaret.com, and take a look around, read some of my blogs. There's lots of information about perimenopause and menopause. And then I'd like to invite you to download my ebook, which is Dr. Anna's 9-step plan for escaping hormone hell. You'll also receive a complimentary subscription to my newsletter when you get your download. So that's it for now, and thank you for watching, and I will talk to you soon.